歡迎大家嚟。
Welcome to today's media briefing. Today we have Dr. Chang Shuk-kwan from the Center for Health Protection and Dr. Linda Yu from Hospital Authority. Dr. Chang will talk about the latest cases situation. Last night we confirmed 76 cases. Case number 10011 to 10086. 35 male, 41 female, aged between 1 to 90 years old. So far, we have over 60 preliminary positive cases. In these 76 cases, 4 of which are imported cases, all from a foreign domestic helper from Indonesia. 1 arrived on 22nd, transit via Singapore. The 3 others arrived in Hong Kong on the 10th of January and left a 12-day sample. And the 72 cases, 27 of those of untraceable origins. The other 35 cases are linked to other cases. In these 72 cases, 17 of those were picked up from temporary testing centers. 8 are from the Yau Ma Tei district, 2 from the Sham Shui Po area. In the 72 local cases, 23 of those are from Yau Chim Wang district. 11 of those are from the restricted area. The 12 other cases are outside the restricted area. 6 cases are from Sam Shui Po. 4 are from the compulsory testing building case. And in the restricted area, we have 12 cases. We have tested over 7,000 samples. And we have so far located 12 cases. And the preliminary positive cases, after stepping up testing, the 12 cases are now confirmed. And they will be included in tomorrow's figure. Besides the 2 from a same family, 1 from a 3-person household, and another from a 2-person household. The other 7 cases are scattered. Sporadic cases in Kensington Plaza. The samples result has returned. Of the 27 samples, 8 of which turned out positive from the ventilation fans or washing basins or the water outlets and the floor drains or on the door frames where we found positive samples. A few buildings are to be subjected to compulsory testing. And for those with 2 affected units, 1 is a Chi Tat House of On Tat Estate in Kwun Chong. 2 units with 1 case each, different floors and different unit numbers. Another building is Ning On Mansion of Tai Ku Shing. 2 units with 1 case each, different unit number and different floors. In Sam Shui Po, a specified area, we have 1 more building with 1 unit with 1 case. The building is number 84 Nam Chung Street. 1 unit with 1 case. And Kwai Chung Shek Yam Shek House, the residents are subject to another round of testing. And this will be included in the scope of compulsory testing. And that's the end of today's report. Dr. Yu, please. As of today, 9 a.m., in the past 24 hours, the Hospital Authority have reported a total of 77 cases. one 72-year-old male patient with chronic condition, case number 8449, were diagnosed with COVID-19 and checked into Kwangwa Hospital on 24th of December for treatment. After treatment, the patient retested negative. On the 12th of January, the hospital lifted the isolation, and the patient deteriorated and passed away on 1:40 this afternoon. With this patient today, a total of 165 patients and passed away in public hospitals. In the past 24 hours, we have another 35 confirmed cases recovered and discharged. Case number 9940 on the discharge on 22nd of January. Altogether, we have 9,433 cases recovered and discharged. We have 776 patients scattered across 24 hospitals and Asia World Expo Community Treatment Facility. 36 are in a critical condition, 35 in a serious condition, 706 5 in a stable condition. Currently, negative pressure beds stand at 1,224, utilization at 68.1%. Negative pressure wards stand at 667, utilization at 76.6%. I'd like to announce two news items. And on a facility management from the Kowloon East Cluster had a fever on 22nd of January. The following day, he seek medical attention in the staff clinic and transferred to any department and perform COVID-19 testing. The test result report preliminary positive the same day evening. This staff is currently waiting to be admitted to the hospital for isolation and treatment at home, and the case in a stable condition. The building this case is in on the 22nd of January have been listed as a building subject to compulsory testing. The hospital infection control team have conducted contact tracing. This staff worked in the Sha Tin Hospital on the last working day on January 21st. Responsible for clerical duties and do not interact with patients and wear surgical masks while at work. Thus, no patients were classified as close contacts. 4 colleagues who shared a meal with this case are defined as classified contacts and will be sent to quarantine. On 20th January, the case been to the Prince of Wales Hospital for a meeting. The meeting participants had wore surgical masks. Acting out of caution, the cluster have arranged the other dozen or so meeting participants and over 30 staff at the department for testing. Currently, they are waiting for the results. The department office have undergo thorough disinfection. The NT East cluster will continue to monitor the staff condition and will communicate with the CHP for the latest updates. And in the Korea's Medical Center, one security guard, while transporting a COVID-19 confirmed case in the early hours today, did not wear the appropriate PPE. After risk assessment, since this patient had a high viral load and required on high concentrated oxygen, even though the whole process only lasts for a few minutes. Acting out of caution, the infection control team has classified this security guard as a close contact and will need to undergo quarantine. And that's the end of the report. We're now open for the questions, and please state the media you represent. First question, the lady at the back. Good afternoon, TVB News. First for HA, that the 2 staff from Sha Tin Hospital and the Caritas Medical Center, what are the possible transmission sources? Like the Sha Tin Hospital, the case not require interacting with patients. Is it possible that he infected at the case with got infected at home? For the Caritas security guard, that case failed to wear full PPE. Was that due to a shortage of PPE or that's due to the case own negligence? And for the Jordan restricted area, so far we haven't had any figures reported. With any residents is still in the incubation period that may turn out negative, do you see you need to get tested a second time, compulsory testing, and when will it take place? And Professor David Hui mentioned the area near the fruit market should be considered introducing a lockdown. According to the CHP website, the Dundas Street, Pitt Street, and Dong An Street and have 72 cases so far. Would you see that at a large-scale community outbreak, would you see the area to be designate a specified area for testing, or would you consider a lockdown like Jordan?
Well, for this Shelton Hospital case, the patient's work doesn't involve contacting patients at a hospital. And as far as we know, we do not know she has come into contact with other patients. And we think that the source of the infection may be from the community, but we will carry on the investigation. As for the Caritas Medical Center security guard, we have PPE that can last for 6 months. Maybe that staff has just forgotten to change to appropriate PPE. As for the Jordan restricted area or other questions concerning the lockdown, maybe you can put your questions to relevant officials in a press conference later. The other lady there? I'm from TMHK. I want to ask about the 12 confirmed cases in the from the restricted area, and they will be counted towards tomorrow's figures. So from which buildings today do you have the numbers of their units? And for these buildings, are there other confirmed cases? What do you think the infection sources would be? Are the buildings involved in contaminated sewage samples? And you say that after 1 week there should be well, some people say that after 1 week tests should be conducted again for residents of the restricted area. So what do you think? So what are your plans for the second testing for the restricted area residents? And I want to ask about Cornhill. And up to today, we have seen 7 cases from Cornhill Garden Block N. Do you think there is a risk of outbreak there? And do you think there may be vertical transmission like Kensington Plaza? Now, for those 12 places, we have not included them into today's figures. They will be counted tomorrow towards tomorrow's figures. So we will give you a more detailed analysis tomorrow because I do not have the relevant details now. As for Cornhill Garden, there are 4 units involved, and 2 of them are on the same floor, and as for the others, they are on different floors. But we haven't seen the vertical phenomenon as in other places. Next question. The lady on this side. I'm from Now TV. Well, for the Caritas Medical Center security guard, under what circumstances did he come into contact with the patients? So was the circumstances not desirable? So that's why he's regarded as close contact. And how about the viral load? You said it was high. And for the restricted area, what's the exact number of confirmed cases now? For the Caritas security guard, he was assisting in transporting and escorting a patient. He has to pass by some corridors and take elevators. As for the CT value of the patient, is lower than 20. Well, for the restricted area, at the moment we have found 12 confirmed cases. 5 of them are about 2 families. As for the other 7, they are isolated cases. And English questions.
TMHK. Dr. Chuan, can you just briefly tell us, do you have some more detail about the 12 cases you've identified in the restricted area in Jordan? Like, what are their occupation? Are they of ethnic minority descent? And what do you think of the positive rate? Is it higher or lower than? So far, you've got 12 cases out of 7,000 cases tested. Do you think the positive rate is higher or lower than what you expected? And what will authorities do to follow up on these cases to make sure that the transmission of the virus is cut off, stopped in this area after this lockdown exercise? And you've also identified some cases in Shamshirpur and a building in Mongkok. Do you think a similar lockdown exercise is also needed in these districts?
I don't have detailed analysis of the 12 cases identified. The positive rate is about 0.17. So there's still 12 cases identified. So we have put all those close contacts under quarantine. And also because some of the cases, if not all of them, they are staying in subdivided flats. So we'll put all those who share those subdivided flats, even they are not in the same household, to under quarantine as well, so as to minimize the risk of transmission. Yeah. As for the lockdown and other details, you may ask these questions in the following press conference.
Any other English questions?
Good afternoon, Dr. Chang. We'd like to ask if Indonesia might need to also be put on the should any Indonesian flights be banned now, considering the quite a few cases coming in via Indonesia recently? And we would also like to ask if you would consider imposing a second testing for residents in the current lockdown area, and if so, when will it be? Thank you.
Indonesia is already a high-risk place where we're asking for testing and also the 21-day negative test result and 21-day designated hotel. I do not have any further information on concerning lockdown.
Next question. I'm from Ming Pao. Well, for the Yau Ma Tei restricted area, now we have 12 cases. So you do not have the relevant information, and which buildings are they? Do these residents live? Can you give us more information? And you mentioned 0.17%. That is the positive result. That means 12 over 6,900. When we compared, the former ratio is 0.3%, so it's almost 50% less. So what do you think of the present ratio? Do you think that some people have left the area earlier? They might have been carrying the virus, but they haven't taken the test. Well, theoretically, this is a higher risk area, so why is the rate so low? And do you think these people should be tested 1 week later? And there's another question concerning Yau Ma Tei. Well, for the fruit market, we have seen over 60 cases from 15 buildings. Experts say that you should pay attention to that. Maybe you should consider locking down the fruit market as well. So have you visited the buildings in the vicinity, and what's the progress of the relevant investigation? Why there are so many buildings involved in that area.
你嘅數點？
How do you come up with the figure? Well, back at the universal community testing program, I think we located about 30 or 40 cases out of over a million tested. Let's say 40 divided by 1 million. It should be 0.004, and currently it's 0.17. It shows so the current figure is higher. I don't know what you're referring to. Of course, the tests taken at different stages of the pandemic will be different, and at the UCTC stage, pretty much the end of another wave, but now we're seeing a community outbreak, which will lead to a higher positive rate as anticipated. Well, if you ask a sizable population to get tested at random, of course you would definitely locate some cases. And for the question on the restricted area, you can wait the Secretary for Home Affairs and Secretary of Health to talk about this. Next question. The lady in the middle, Apple Daily. I would like to ask Dr. Chong, of the 12 cases in the restricted area, can you give us a simple breakdown of whether they live in the subdivided units, and are they, what are their line of work, and what is your tentative guess on their source? There's some claim there are over 3,000 people who have fled before the lockdown begins. And for these 3,000 people who left the area, would you lead to some risk in curbing the pandemic? And do the CHP is confident that the tests will be completed by 6 a.m. and the order to be lifted? And TMHK Apple Store in 財星集團大廈 as for case 9960, is this from the TMHK Apple Store? We suggest them to close for 7 days. And does the staff work in Yamate? And the Choi House for 9741, they report negative before retest as negative before to retest as positive. The CT value is quite low, which indicate a high, very low, but couldn't have been picked up. And the public got tested by sampling. But this method, is it possible that it been tested negative, and even they got negative and free to grow about, and which may lead to false negative? So how can you inspire the public confidence that this mobile testing station are effective? Would you consider nasal swapping or installing a fill tube instead of using this current methodology, which led to false negatives? Of the 12 positive cases, I haven't matched against the building list to see whether they have came up positive in the sewage surveillance. And for Wusong Street number 5, it's a building under compulsory testing. Some live in Temple Street and Shanghai Street, Reclamation Street, Pak Hoi Street, and Battery Street. And we have another case in Wusong Street. I yet to have time to conduct a building by building analysis. For 9741, for the testing result, the FHB have issued a press release. I have yet to look into it, as I am not an expert in laboratory testing. So what is the best methodology? We need to consult the experts. And for the individual cases, for example, the Apple Store case, I will not talk about it specifically. When a workplace reported any cases, let's say as some members of the public have been to a particular store, we would not ask the store to close. We just ask them to undergo disinfection. If a staff is infected, we usually ask them to close for 14 days. And for any close contacts, we'll arrange quarantine. For the non-close contacts, we'll arrange to get them tested. That applies to all workplaces. And for the case in individual buildings, we will not talk in detail. For the negative results, we not double confirmation. The positive cases, the preliminaries already be completed. I know that we have taken some samples. If they turn out positive, our laboratory will do another testing. Speaking on the mic. Well, let's say deep throat saliva collection and sampling in hospitals, and any sampling taken in any time is possible. It is not just occurring in temporary collection stations. Sometimes at different samples, maybe some of the samples will test negative or some may test positive. This all depends on the time and place of collection. Next question. Oriental Daily News. And in the restricted area, as mentioned, there are 12 cases. The Secretary for Environment, Dr. Wang Kamshing, mentioned that the 90% of the samples turned out positive in the sewage surveillance program. Looking at the results, we only located 12 cases. By matching against this data, how can we interpret? Do we see that the sewage sampling is not an effective tool in help locating silent carriers in the community? According to Dr. Chung, do you think that any methodology may lead to false negatives? I'm not too familiar on how to interpret the sewage data. Generally speaking, and if we found a positive sample in the sewage in the lower floors, it's possible that someone in the upper floors may be excreting or shedding virus. So these are the cases that are yet to be located. Or some of the cases are led to discharge patients. Sometimes they may have antibodies in their bodies and they're not infectious anymore, but their excretion may still carry the virus, which would say that, call it a rebound. So some may shed virus for quite some time. It would, well, as we use the sewage sampling, you do not need to test the whole building. By taking a few samples, you may have found cases in the upper floors. It will just as an auxiliary little tool to see that whether a building has been cleared of virus and so on. As for how long did the soil water stay in the plumbing, it will take some time to find out. False positive. This is not really a standard terminology. Very often we see some cases that they may initially test negatives. A few days later they feel unwell and get tested again and come back positive. That doesn't mean that their first sample was negative. Maybe at that time they did not carry any virus at that time, or the viral load was so light that the testing method couldn't pick it up. Therefore, you can't say that the samples before the positive samples conducted were all fake, false. HK01. A question on the restricted area. We heard there are 2,000 or 3,000 residents who fled the area. How you managed to track down who left, and how to appeal for those residents who left. In these 12 preliminary positive cases, are they connected or they came from the whole same household or so on? And for case 9741, then a poly worker have tested twice negative and finally positive. Upon confirmation, at the second test, it showed positive to virus, but very light viral load. But why was it classified as a negative result? What is the CT value as you define as being positive?
被 lock
Some people are afraid of being locked down and they move out of the area. I would like to call on them to take compulsory testing as soon as possible. And if they feel unwell, please go to a doctor as early as possible. And you mentioned the 12 persons. What's your question? Well, for those 12 cases, 3 of them are from the same family and 2 of them are from another family. And for the remaining 7, they are not connected. We haven't found out if they are connected. As for 9741, I haven't looked into the results in details. The Bureau has issued a release on that. If you want to know the details, you can ask the relevant experts concerning the CT values. I'm not too familiar with that. Well, for those who have left the area, we cannot track them down. Next question. The gentleman here. I'm from cable TV. Well, there are 27 cases without known sources, and local cases 72. You think these figures are quite confusing, and for false negative cases, shouldn't you do another test for those residents who have left the area, and if they haven't taken any test, would legal action be taken? For the 72 cases, 22 of them are not related, and for 35 of them, let me count again. Please wait. "72 cases minus 27 cases. Sorry, 45 cases are not related. Sorry, I mixed up the figures. And 27 of them are not related. Well, for testing, it just shows your condition on that day. If you do 2 consecutive tests, it may not be very useful. So for the buildings that are subject to compulsory testing, or you're a family member of a confirmed case, then we would ask you to take a compulsory test. At that moment, we want to know whether the result is positive. If it's not positive, well, then we will have to wait for the incubation period. And if there is an onset of symptoms, well, of course, we will do another test. As to whether we will definitely do a test after 14 days, we will have to look at the situation. And if for the first test we've found many cases already, then we would suspect that there are a lot of people going through their incubation period. But if for the first test we do not find a lot of cases, of course, it's good to do a second test, but we will have to look at the allocation of resources first. Next question. Last question, the gentleman there. I'm from AM730. I want to ask about the Yau Ma Tei restricted area. Now there are 12 confirmed cases. There are preliminary confirmed cases. And another reporter asked about the Apple Store case. Well, people have a lot of questions concerning confirmed cases in the community. And if you do not tell them the addresses of the confirmed cases, then people will get very suspicious. They think you are covering up some things. So people would really like to know more about the whereabouts of these cases. So do you think you can tell us more? For the preliminary positive cases from the restricted area, we got this from the 51 testing stations. And for those who were confirmed earlier, well, for example, for the cases today, well, today we have 72. For the restricted area, there are 6 cases. We didn't find them out yesterday. They were discovered earlier on. They went through different types of tests. And for the 12 cases I mentioned, they were found out in one go from the restricted area. So this figure doesn't include those that were found earlier. As well, we compare ourselves with other places and countries. We have already tried our best to put more information online, for example, the addresses, etc. For this area, there are 70 to 80 cases per day. Well, almost all of them are working. They may be security guards, cleaners. They may work in restaurants. So we cannot share all these information online. But if they have visited certain places during the communicable period, we would put a relevant list online. And if members of the public are using the Live Home Safe app, then you can get the relevant information. I do not have that information in hand. If there's no other questions, we will end the press briefing here. Thank you.